supposed to trigger that conversation. What I'd like to tackle now is less the inventions themselves, but more the process that we've been trying to put in place within this hospital in order to engage our physicians and later on other members of our staff into the process of innovation, invention, discovery, etc. And this is something which Okay. So in this hospital, we have approximately 7,000 people working every day. Out of those 7,000 people, we have 700 people who are working 24 hours a day, more or less, doing research and development and only R&D. They are not physicians, they are usually not nurses, they are researchers, and they are actually supporting our physicians, which are of course also involved in that process. And so the hospital, I guess Ronnie spoke about the budget of the hospital, so it's approximately 3 milliard shekels annually, and up to 8% of that is going into research. So that's also huge for a health organization, at least in Israel. And the way we are actually looking at R&D within the hospital is a way to leverage our medical services. And we see this as a kind of bilateral kind of incubator. On the one hand, we are very much encouraging, and I will show you a part of what we are doing, our staff to engage into research and development and innovation, etc. And we are also inviting all the companies, and Israel, as you know, is very rich in companies. And if there is one area in Israel which is extremely rich in this kind of in startup companies, etc., it's Tel Aviv. We have a few hundreds of companies that are working just around the hospital. So it's very convenient for everybody to engage in this type of bilateral relationship. Now, what we have been doing over the past 5 years, this hospital, by the way, was considered for many years as a purely clinical institution. And actually, we were very proud of calling ourselves, we are a surgical hospital. And it's only over the past 5 years that the hospital has gone through this transformation and has become a major hub in terms of research and development. And the way we have done that is by defining research as an organizational value. And it means that every doctor here, every department, everyone is evaluated annually twice for his or her achievements in research and development. And it covers everything, not only papers and the kind of usual metrics that we are using, but even anybody who is bringing up an idea, and this idea is becoming a declaration of invention, and it is signed, and we are recognizing the part of each and every inventor into the process. This is actually awarding the department or the person a kind of score. So how do we do that? And so the major problem within in an hospital is what you see here. I'm almost sure that the same is true also in the Netherlands, or physicians or nurses, they don't have time for anything but looking after our patients. And the question is, how do you take those people from their very, very busy day and busy life? And I think that in the Netherlands, approximately, it's also the same as here, where doctors and other people, other employees as well, but mostly doctors cannot make a living of working in the hospital only. So when they end up the day at 4 o'clock in the afternoon, they have to go into private practice in order to earn money. And so how, in this context, do we convince those people who have really nothing to gain into engaging into this type of activities? How do we encourage them to do that? And so we have a number of, we have developed over the years a few tools. One of them is a set of scholarship or fellowship that the hospital is investing into each and every one of our physicians, and we have similar programs for other sectors as well at each and every stage of their development. So we are targeting already medical students who are in their second year of medical school. In Israel, the medical studies are 6 years plus 1 year of internship. So when they are in their second year, we are offering them money to come and work here and do research. And it can be anything. For example, we have just, the last person that we just accepted into that program is doing research on the best way to run health economy in the context of R&D. So how do you invest money from your clinical practice into encouraging research? Nothing to do with the classical conception of research within a hospital. And then it goes on, and each and every one of those programs is actually supporting a physician at different stages of her or his career, when he's a resident, when he's already a senior resident, and even we have a program to support our chairs. The second major challenge that we have is that when you think about that, medicine, and that's the way we still teach medicine, is a profession where everything which is valuable is already known, right? When you look at a patient, and the patient is displaying a certain constellation of signs, if it rings a bell, if it's something that is known, you have a diagnosis, so that's something which is valuable. In research, it's just the contrary. Everything which is known is valueless. And so the question is, how do we take those people who have been used to think in using this type of approach, and we engage them into a process of innovation, etc. And this is something that we are actually doing through our chairs. So they are being trained and instructed in order to promote within their department innovation, encourage their even young residents to raise questions, etc. Most of you are not physicians, if I understand well, or are you?
Some are.
Some are. So those who are, I'm sure that you very much remember the big chief of the service, and you, of course, are not allowed to raise any question when he says something. I mean, that's the absolute truth. And this is something that we are changing within our hospital, and this is also part of the way we are trying to promote staff creativity, autonomy within the different areas. We also encourage industry partners to integrate within the department. So many of our clinical departments are actually having relationship with industry partners. Those industry partners are not working outside the hospital. They are within the department, and that exposes our physicians and other personnel as well to another mindset, an industrial mindset. So what we also do a lot is that we reflect in full transparency anything that is being done in the hospital. So each and every department knows how it is performing, how the other are performing, and we have a number of indexes that we are making publicly available to everybody. We have a lot of communication channels with all of the different departments. Anybody who is publishing a paper, anybody with a big invention, all these things are all the time being transmitted to each and every department within the hospital. And that's just an example of things that we are trying to very much publicize in order to make people understand that the hospital has a very, very well-defined agenda, and it is to promote science and research. As you may know, the IRB, the Institutional Review Board, the Helsinki Committee, is considered everywhere in the world as something which is blocking, preventing, destructing science and creativity, right? Because they are the regulations, so they are stopping us from doing things which need to be done quickly. So this is something, and this is the way it is working in our hospital. So it's a crazy system, and it was wasting a lot of time to everybody. So what we, and the number of research projects that are being approved by RRB every year is climbing up. So now at this very moment, we have 2,300 projects which are running in parallel here. And despite that, what we have been able to achieve is to decrease the number of the time length from submission of a project to its authorization from approximately by half. And we did that by, in this hospital, we don't have one IRB, we have actually 3 IRBs which are running in parallel in order to expedite the treatment of all this regulatory authorization. So this is something that our personnel is looking at, seeing, and we hope that it generate the impression that we are actually pushing research forward. But the major problem is really how to transform R&D into an organizational value. So the first question that each and every of our physicians is always asking us is, so there are so many universities. In Israel, we have the Weizmann Institute, as you may know. It's a very famous institution as well. And so many places where research can be done. So why do we need to do research within an hospital? And the reason for that is, of course, the context. And the context is very simple to understand. What we do have here, which you don't have in any university, is this individual over here, and that's the patient. So while research within an hospital may look like something which is being done elsewhere as well, it is motivated by something which is completely different. We don't intend to contribute to humanity knowledge, but what we intend to do is to each and every day ask ourselves, how are we going to do better medicine tomorrow, better than what we are going to do today? And that's the kind of dynamics that we are trying to promote. That's really the engine behind all what we are doing. And just to show you how this is being translated into so this is a very simple example of how the process is working. This is the Department of Dermatology. As you know, they are looking at blood smears every day. It's taking hours because and it must be done by a physician. And this is, of course, something which is very, very cumbersome as well. It's kind of technique. You have to do all kind of manipulation of the blood smear, etc. So we partner with this company called Scopio, and this was really a joint development project where also the IP was shared. And to cut a long story short, we now have an AI-based system which is analyzing blood smears in the routine hematology lab. It's not research, it's not development, it's something which is part of our day-to-day routine. And this is the kind of process where we have an unmet need or a problem or something which we feel is preventing us from using rationally our resources. And we are trying to find a solution, and then we are rapidly implementing those solutions within the hospital. And this is the difference between the type of research which is being done in universities, etc., and what is being done here. Here we are, I think, what is characterizing the type of process that is going on here is that it is rapidly bringing us from the patient needs to new solutions. This is something which is even more, I would say, counterintuitive. As you know, genetic counseling, there is really nothing more sensitive than the encounter between a genetic counselor and a family. The family has a child with a genetic disease, and now the woman is pregnant, and she wants to know what are the chances of having another child with a genetic disease. So this is really dramatic moments for the family. And intuitively, we may think that this is something which, of course, requires a direct physical encounter between the genetic counselor and the family, right? Because you need this interaction. But we don't have in Israel enough genetic counselor, and this is a problem which is of worldwide dimension. I'm sure that you know of that. We have a few dozens genetic counselor for the entire country. So impossible to provide proper genetic counseling to anybody who is in need of that. And this company identified, partnered with our Institute of Genetics in order to develop a program where genetic counseling is provided through a small movie. And the movie is actually featuring people who are looking like the family and the genetic counselor. So they look at themselves in the movie. And the movie is providing the kind of equivalent of a genetic counselor family encounter. And so at first you may think, well, that's something which certainly will encounter a lot of resistance. People will say, well, that is impersonal, it's a movie, it's not a real human being. So when we ran a satisfaction survey, the families were much more satisfied with this type of genetic counseling than with the regular one. And the reason is very simple. When you encounter your genetic counselor, time is limited. You have to run through different procedure. Here you have a movie that you can run again and again, ask yourself questions, go back, go to the internet, think about different issues. And there is also, by the way, in this program, the possibility to ask for a face-to-face encounter.
And what percentage of them go to face-to-face in the end?
Very few.
5%?
Something, a few percent. And the reason is that, of course, fortunately, most of those genetic counseling encounters are to inform the family that everything is okay. הם ראו, נכון? No? Okay, so that's...
So we need to, just for time, we need to leave it 4.
Masha? Okay. We'll see what we can make. So, by the way, so I would prefer actually to use those 14 minutes instead of showing you more and more of our amazing hospital and inventions. If you have questions or you want to ask things which...
One thing we heard as everywhere in all our visits, COVID was wonderful. I mean, you basically you have a crisis and you can implement lots of things. What has it done for you to make the R&D, to accelerate it, to make it more practical? How was it for you?
I think that COVID met us at a point where we were already in a process which somehow got, I would say, somehow accelerated by COVID. And it was, so we realized, as I said before, that regulation and all the different non-scientific aspects of the discovery process within an hospital needed to be worked out and simplified. And when COVID came, so there was a need for rapid answers or rapid authorization to run. We had a lot of COVID-19 related clinical trials within the hospital, and somehow we were reassured by the fact that the whole establishment in Israel and worldwide were very much encouraging us to run quickly through all the regulatory process, and that helped us actually to accelerate a process which was already on its way. So that's one.
Your CEO was called the COVID Tsar.
Yes, he was.
He of course, he brought a lot of questions which he needed answer to your department. Did that mean more people, more money, more attention?
More money, not that much. COVID actually had positive effects, but on the other hand, I must also admit that we have learned a lot during the COVID area about the need to, on the one hand, try to be efficient in terms of the regulatory process, but on the other hand, not to compromise too much. And I'm sure that you have been all exposed to many very famous stories, like Israel bought, I don't know how many tons of hydroxychloroquine. I don't know where they are now stocked somewhere, because everybody thought, based on not well-controlled studies at the beginning of the pandemics, I don't know if you remember that this was ivermectin came after that. We were already more suspicious when ivermectin came in, so that was okay. But still, I think that we have learned also the fact that we need to be efficient, but it cannot come at the price of compromising with the basic principles of clinical trials, and things must be done in a controlled way. It must be done in a careful way as well. So I think, we have also, and everybody, I guess, learned also lessons from COVID. Another aspect of COVID, I will take the counterpoint of what maybe Ronnie was speaking about. So there are also something which are less bright with during the COVID area. For example, I think we have all learned some lessons of humility during that period. Yeah. Everybody was, for example, in this hospital, we developed a model which was later on adopted by the Ministry of Health to predict the number of severe cases, because this was actually what was threatening the health system in terms of burden, etc. And through that also we learned that we were able to predict, but only to some extent, the dynamics of the pandemics. And so I think that COVID helped us
and
to...
it was more or less or...
Well, it was sometimes we predicted more, sometimes we predicted less, and I will just tell you an anecdote because it's an interesting thing. At some point in October 21, I think there was a big surge here in Israel of COVID, and our model predicted much less severe cases, much more severe cases than they were actually. And this was really very annoying because, as you may remember, that's the period where the press was all the time asking for information, and we were all the time on the news, etc. And missing the right numbers was not something very, very nice. Until we realized that actually our predictions were accurate, but the problem was that the severe cases were not admitted in the hospital because people were less confident in getting admitted in the hospital, but they were being treated outside the hospital. And actually there was a study performed by two researchers who counted the number of respirators that had been hired by private people at home. And so this number plus our number equaled this number plus the official number of severe cases equaled our prediction. So you see, there were a lot of things that we learned during this COVID period, but I think that people who looked at that period in a rational fashion will find in that period there were very good things which really helped to accelerate different processes within the hospital, but there are also things that we will need to remember for the future, and we are not yet done with that pandemic.
So in the follow-up question, do you think now with all the knowledge and all the evaluation you've done, what you know, what you don't know, that you're totally confident that you're prepared for Q4 of this year?
So first of all, I think that's what I was just saying. I think that now we realize more than ever that we should never feel completely prepared. That's why we should actually prepare ourselves for a worse scenario than the one that we are expecting, and that way we have only good surprise. And that's what we are doing. So we have now, I think that we are also, we have learned, if you are speaking about the pandemic, right?
Yeah.
I think that we are also looking at the pandemic in a different fashion. We realize now that it is something which is becoming part of our life as an hospital. And so we are, I think, accommodating the different constraints due to the pandemic in a more rational fashion, in a better I would say in a more in a more systematic fashion. So we look at the data, we analyze them, and we derive from that a set of actions which I think is much more rational than in the past. In the past we were, of course, as everybody, we didn't know exactly what we were facing. Now I think that we are a little bit more knowledgeable about the pandemic.
Okay. Could you also say a little bit about budget? How is everything financed? I mean, sometimes your CEO popped out. He said, "Oh, it's charity." You know, suddenly a big tower of 20 things came out of charity. How are you financed?
So research in hospitals is a kind of close budget, so we are not budgeted at all as part of the etc. And 3 is a lot of money which is also flowing from the industry into the hospital in order to fund either clinical trials or common or joint R&D projects. So that's the 3 major sources of income, and within
how much is that per year?
and within this hospital, it depends how you look at. So we have, in terms of pure income, approximately a little bit more than 100 million shekels a year. But if you look at the rest of the investments that are coming from philanthropy, etc., it is close to 200 million shekels a year. So that's for this hospital. Yeah, it's as I said before, we have it's quite difficult to provide an accurate estimate of that, because we have, of course, many activities which are taking place outside the hospital, are being funded by external bodies, but still are connected to the hospital.
Yeah. Then. We were told by
Omer
that you have about 1,000 contacts, 1,500 contacts of people who want to work together with you. You only can provide connections with 25, so you refuse a lot of things. It's a very Darwinistic process. Are you happy? Huh?
Under joint ventures.
Yeah, joint ventures and implementations of that. Do you think that you have an? We've heard from a lot of incubators. And a lot of Rambam, where you used to work too, I think, that they have all this connection. But it takes a long time before something practical comes out, all these external new startups and that kind of stuff. I mean, you show the results, but a lot of times you have to wait 5-6 years. Isn't everybody getting impatient about the results?
Sure, but what we are actually doing, and we are trying to balance the type of project that we are supporting. So we have very early projects, even preclinical projects, up to something that you could call the pilot project, where we have a new imaging device, a new CT, for example, which is very close to being fully developed. And this is the type of project that we are also getting in. Of course, the earlier the project, the larger the contribution of the hospital can be, and also at some point the ROI that we can expect from that invention.
I can say that a Gen 5 project that Professor Sprecher showed, I think from initiation to actually starting using it took less than a year.
No, a little bit more, because it was 3 years altogether.
It's based on their current platform.
Exactly. But it's it depends, and also, of course, pharma projects are different than device project. Digital health is, of course, the quickest, but also very often the quickest to fall down also.
Yeah. Any more questions?
So I wish you a very nice stay. When are you leaving? Friday. Oh, so you have some time to enjoy. Will you be touring a little bit or just working?
Oh, Jerusalem. Yeah.
You came by foot. Okay, that's very good.
One more thing. If we want to work together, we have a lot of academic hospitals here and normal hospitals and universities. If they want to work together, what would be the way to do?
Just drop me a note, send me an email, and I'll be more than happy. If it is something which is interinstitutional, I'll be the person to contact. And if there is something specific that you want, somebody that you are looking for as a partner in a given domain, I'll be happy to make the contact as well.
Thank you very much. Amy, thank you for being so frank and open about it. We have a little thing from the Rijksmuseum, it's a national museum, and we have some Dutch porcelain, and we hope that you will think about us from time to time. And we like to connect to you, like to reach out to you and see if we can do something practical.
Wonderful. Thank you very much.
Thank you very much.